When we were upstairs at County Attorney Bull's office, there was blue monitors and incandescent lights, and I said, wow.
That's what we're on.
That's space, but we're gonna keep it.
Good.
Good morning. Or afternoon.
Afternoon,
Whatever.
whatever day, time it is, yeah.
Oh.
Martina, are we on the webinar?
The broadcast is now.
All right, good afternoon, everyone. Thank you very much for being here today. Welcome to the Maricopa County press briefing for this August 5th. It's hard to believe it's August. Thanks so much for being here today. Thank you to those of you that are joining us on YouTube and Facebook as well. And those reporters and members of the media always bringing us the great questions as we hold these press briefings weekly. So my name is Fields Mosley. I'm the Communications Director, also the Lead Public Information Officer with the Joint Information Center here at Maricopa County. Today, we're going to tell you a bit more about a work group that was formed over the past week that includes educators, public health officials, and Marcy Flanagan, our Executive Director of the Department of Public Health, is going to really outline this input that we're getting on the guidance for schools reopening and possibly having in-person learning at some point. So she'll tell you a little bit more about the progress that they've been able to make with this group, what they've learned from this group, and how that will work its way into the guidance as we wait for metrics to come from the Department of Health Services. Also, Medical Director Dr. Rebecca Sonnenschein is with us today. She'll talk about what we're seeing in the data as it relates to public schools and private schools and schools in general reopening, and then potentially going to hybrid systems and in-person learning as well. Also with us today, I have the Director of Emergency Management, Robert Rowley. He's here to answer any questions you might have as we go forward, whether it comes down to planning or the response from the Unified Command when it comes to logistics or personal protective equipment distribution as well. And Joanna Molina, as always, she's from Public Health, and she's here to translate those answers into Spanish for members of the public or members of the news media who are joining us, and they have bilingual viewers, or they have Spanish outlets that they would like to deliver that information in Spanish. So quick reminders as always, members of the media, as we get to the question and answer portion of this, please virtually raise your hand in the GoToWebinar and we will call upon you. Make sure your microphone is unmuted at that time, and we will unmute your mic on this end and Chad will call upon you. If you're having some trouble, if the hand is not raising in the program, if your mic is not unmuting for some reason, you might want to log out of GoToWebinar and then log back in. That usually solves the problem. We cannot just unmute you on our end. That is on your device. So with that, I invite Director Flanagan to come up and talk a little bit about schools reopening and everything that public health is considering at this time.
Thank you. Good afternoon. My name is Marcy Flanagan. I'm the Executive Director for Maricopa County Department of Public Health. So over the past several weeks, we have seen some encouraging trends in our numbers, including a steady decrease in our number of positive cases that are being reported on a daily basis and a stabilization in our hospital rates. Dr. Sonnenschein is going to talk more about these numbers later, but I did want to take a moment to recognize the efforts by the community that have contributed to helping us slow the spread of COVID-19, such as wearing masks, staying 6 feet apart, and staying home when possible. While it is indeed a great step in the right direction, we cannot let down our guard. Online learning has already started in many of our school districts, and many of our community members are anxious to hear when students and staff might safely return to in-person instruction. We have been working with school administrators and others on how to hold classes in the safest way possible. Through these ongoing conversations with school officials, we learned that there is an increasing desire among school districts, leadership, and other key decision makers for additional guidance from public health. In response to that need, we set forth a plan to pull together a representative group of decision makers from the education community to bring forth concerns, needs, and ideas about school reopening through the lens of their respective roles. In turn, we would share more about what our role would be in providing data and guidance to better help inform their decision-making process. Given the size of our community's public school system, we knew that it would not be possible to have representation from every school district in the work group. To address this issue, we developed a regionalized approach to identifying district superintendents to participate. We worked with our Board of Supervisors and the Arizona School Administrators Association to help us identify leaders from school districts representing all regions of Maricopa County. We also included representatives from the School Nursing Association and charter school leadership. It was important for public health to form a local work group that was able to look at our local data and our local needs. This past week, we convened our work group for the first time. We covered a lot of topics. We learned a great deal from our participants. Understandably, there was a great deal of interest and discussion on what metrics might be put forth by the state for determining how and when schools should reopen. Participants also expressed a need for more localized data about COVID-19 transmission so they could help them monitor the ongoing trends and inform their decision-making. Again, Dr. Sonnenschein will speak more about both of these points in just a moment. While ensuring staff and student safety were the top priority shared by all, superintendents also voiced concerns on other reopening issues, such as special accommodations needed for students who require one-on-one instruction or adaptive learning environments, and how to safely reenter our medically fragile students to on-campus learning. We have taken back these concerns and additional feedback they provided to us to Arizona Department of Health Services in hopes to better inform their decision-making process as they roll out their guidance in the coming days. Once we receive that guidance, we will go back to our work group to share these benchmarks and discuss how we can provide additional support, guidance, and data to assist school districts and decision makers. I'm going to turn it over to Dr. Sonnenschein to go into more detail about the metrics and data we discussed with our school work group.
Thank you, Director Flanagan, and good afternoon. As you hear reports about our case numbers decreasing, it may seem like getting kids back to school should be happening sooner rather than later, and we wish it were that simple. I want to clarify what role public health will play regarding how and when to resume in-person education. In the end, schools are going to have to make these difficult decisions on when and how to physically reopen school buildings for in-person instruction. Public health will provide specific guidance to schools on what data are most relevant to inform them about the level of COVID-19 transmission in their community. These data will be available to school administrators and the public on our website, along with recommendations for strategies to make the on-site learning environment as safe as possible. We've heard loud and clear from school administrators that having specific metrics for a safe reopening are essential to their decision-making process. While we're waiting on state recommendations, we've been reviewing metrics from other states and organizations across the country with key stakeholders and getting ready to provide the data for the state metrics to help inform decision makers. When we boil these metrics that we've reviewed down from various sources, there are really 3 types of information that are used in the majority of guidelines. The first is a decrease in the number of cases and or the rate of cases per 100,000 persons. The second is a decline in the percent of tests that are positive. And then the third is having a specific cutoff for the percent of tests that are positive. This cutoff or threshold can indicate when in-person teacher-led instruction can be implemented. Most agree that these indicators need to be sustained for a full 2 weeks to ensure that the data are stable. We also know that it takes time for test results to be reported to public health, so we typically go back 2 weeks to make sure that the data that we're looking at are complete and include everyone who's been tested in that time frame. Now let's talk about where we are in Maricopa County as a whole regarding these metrics. We've definitely been seeing a steady decrease in the number of cases reported to public health, from about 2,500 cases per day down to about 1,400 cases per day about 2 weeks ago. Looking at the percent of tests that are positive, we were at 21% a month ago, and as of July 19th, we were down to 13%, which is a considerable improvement. However, most agree that having less than 5% of tests being positive is a reasonable indicator that there is both enough testing available and that community spread is decreased. While we don't know what the metrics from the Arizona Department of Health Services will be, we're preparing to provide the data in an interactive COVID-19 data dashboard for schools that will incorporate these metrics, including case counts, rates, and percent positivity by zip code, school district, and city, which will be updated weekly. We will also reconvene the work group to discuss any further clarification the schools need about the metrics and when and how they can access the data on our website. The dashboard will help our local school officials, educators, parents, and other community members to inform decisions about school reopening strategies. It can also be used to monitor for signs of increasing community spread of COVID-19, which may trigger a need to pull back on in-person learning if that becomes necessary. Remember, keeping schools open doesn't just depend on the actions of the schools, but the actions of the entire community. We know COVID-19 is still widely circulating, and everyone needs to continue to do their part to keep the virus from spreading. Stay home when you can, wear a mask when you go out, and please wash your hands. Thank you for doing your part to support schools and public health in Maricopa County.
Don't forget the mask. All right. Thank you so much, Marcy Flanagan, for joining us, and Dr. Rebecca Sonnenschein as well. At this point, we'll open it up for questions for members of the media who've joined us via the webinar. And Chad, let us know who is in line.
Looks like Danielle Lerner has our first question.
Okay.
Danielle, your microphone's live.
Danielle, can you hear us? I cannot hear you.
Can you hear me now?
Yeah, with quite a bit of feedback there. Not sure whose microphone is up a little high there. Danielle, can you go ahead with your question?
Okay, let's try that again.
Okay, I think maybe we'll get some technical things worked out with her.
Yeah.
And move on to Peter Seymour.
Okay, so hang on a second, Peter. So Danielle, if you are on the phone part of it, but you also have the microphone open on your computer, or however you're joining us via the webinar, those things will create that feedback loop, and we can't help you there. You can only be providing us audio and also listening on that same device. So so try that, a single device, and then come back in, and we'll get your question answered, hopefully. So Peter, go ahead with your question.
Good afternoon, everybody. Can Dr. Sunshine explain a little bit more about what the cutoff means?
The cutoff as it relates to?
The three platforms as to, what the metrics as for reopening classrooms, decrease in rates of cases, decline in positive tests, and then I need a little more specifics on cutoff, what that means, the definition, the measurement of that.
So I guess, we could look at that. What are the ideal numbers in those three categories that would lead to in-person learning and in classrooms? Dr. Sunshine will take that question.
Thanks for the question. So the cutoffs or thresholds that I referred to before were related to the percent of tests that are positive. What we're seeing in the literature and in a lot of other guidelines is the most common cutoff that we see used is that 5%. And that is generally believed to indicate that there is both enough testing happening in the community to ensure that everybody who wants a test can get one, as well as a reasonable level of community spread that it's decreased from a severe outbreak level. So that is what that 5% is thought to mean. That being said, there's not an agreement on exactly when you can reopen schools and resume in-person led instruction. And we don't know if thresholds or cutoffs will be used in the Arizona Department of Health Services guidelines. All we can do right now is review what's out there in the metrics in other guidelines.
La pregunta que se hizo es, ¿cuál es el sistema métrico para la escuela o cuáles son las tres plataformas que se mencionaron ahorita precisamente? Bueno, sabemos que el número de pruebas que son positivos, eso significa que solamente el 5% salgan positivo y que también ese número es el más común de acuerdo a la literatura médica que hay al momento. También significa que hay suficientes pruebas, suficientes lugares donde la gente puede acudir y hacerse la prueba y el resultado de esas pruebas solamente el 5% salen positivos o menor. No hay un acuerdo o un sistema métrico que hay que seguir todavía, no se ha dado a conocer por el Departamento de Salud o Servicios de Salud del Estado y es lo que se está esperando.
Peter, thank you so much for the question. Chad, who do we have next on the line?
We have Rocio Hernandez. Rocio, your microphone is live.
Hi, can you hear me?
We can.
Hello?
I can hear you. Can you hear me?
Okay, perfect. Awesome.
Okay.
I wanted to go back to Dr. Sunshine, if she could talk a little bit about the indicators. She said that we need to have them sustained for at least 2 full weeks, but there are delays in getting the tests back. So I heard her say something about go back to 3 weeks. So she's saying that the indicators should be sustained for at least 3 weeks given the delays in the testing.
All right, thank you so much for the question, Rocio. Do you want to expand on that a little bit? All right, she'll explain a little bit deeper on that and what they're looking for.
Thank you for asking for clarification, and I know this gets complicated. So there's 2 different pieces of this. One is that most of the guidelines agree that you need to see whatever evidence of decreased community transmission you have, whether it's a decreasing rate of cases, number of cases, or percent positivity. You need to see that sustained for 2 weeks. And that's just to tell us this isn't a one-off. This isn't bouncing up and down. This is really a sustained and stable rate. And then the second half of that is that we always go back 2 weeks to look at whatever data indicators we're looking at, and that's for exactly the reason that you just said. Because we know that when you get your lab test collected, it can take some time for that to come back to you and to get reported to public health. And that often can take up to 2 weeks. So that's why whenever we talk about these metrics, we're not talking about metrics from today or even last week. We go back 2 full weeks so that we know that the data that we're looking at are reliable and complete.
La pregunta es que si los indicadores que ha mencionado sean sostenibles por 2 semanas o por 3 semanas, de acuerdo a los retrasos que existen en los laboratorios para dar resultados de pruebas. ¿Cuánto es el tiempo que debe de haber? Bueno, son dos cosas un poco diferentes. La primera es que según la guía que existe al momento, cualquier evidencia que muestre que hay una disminución en el índice de casos positivos que sea sostenible por 2 semanas. También sabemos que una vez que se reciben esos resultados, hay que regresar 2 semanas hacia atrás y revisar si los que estamos viendo ahorita son de hace 2 semanas o son recientes. No hay un sistema métrico que sea una medida para el día de hoy específica. Siempre hay que regresar y medir hacia 2 semanas atrás para ver el progreso hasta la fecha.
Thank you for the question, Rocio. Appreciate it. Who else do we have on the line, Chad?
We'll go ahead and give Danielle a chance here.
Good.
Danielle?
Good. Danielle, can you hear us?
How about now?
Yes, we can.
Okay.
Still getting a lot of echo here, Danielle. So it's either you've got 2 speakers on, 2 audio sources on your end, or 2 microphones open. Would be my guess, anyway.
Mute the laptop.
Yeah.
Speak from the phone.
Did you get it figured out?
I'll go ahead and help her in the chat, and we'll move on to
Okay.
David Caltabiano.
Okay.
David, your microphone is live.
Okay, thank you. And thank you for saying my last name correctly. I appreciate it. Is there any level of concern from that work group in terms of personal protective equipment for educators and administration, possibly even students who have predisposed conditions? And can county health at all help with that supply? Also, that's my first question. Second question is, Dr. Sunshine talked about the 3 steps to reopening schools. What happens if we shoot back up when schools are back open? Do we just close it back down if we go past those metrics that you mentioned?
All right, good questions, David. Thank you. Let's start off with Marcy to talk a little bit about the work group and the concerns that they have, and moving forward with that. And you also mentioned PPE, which I know has come up a number of times, and we made it clear a couple of weeks ago. We showed everybody the starter kits that the Unified Command is providing, and I know they've expanded that, so if we need Rob to jump in here, we'll do that as well. And then we'll go on to Dr. Sunshine. But Marcy, come on up.
Thank you for the question. So regarding PPE and the work group discussion, there were specific concerns related to when teachers had to assist students closely, some of those students needing additional support while taking a test or those sorts of things, and what our recommendations would be when they have to be within 6 feet. As far as supplying PPE, there weren't concerns or discussion related to that. We did, as Fields mentioned, supply schools with a starter kit for their nurses' offices if they see sick children. In addition, we have purchased some cloth face masks that we will be distributing to school districts as well. Related to the last question you asked about what would happen if we go to a level that jumps up and concerning, we certainly did discuss that in the work group, and that was a concern and a question of theirs. So in the benchmarks and guidelines that we provide, there will be clear guidance on what it means when your numbers, if they start to go back up again. So say that our case count does not steady decline, that it actually starts to rise again. So we're looking at doing everything in sort of phases. So there'll be completely distance learning that we'll recommend. Then there'll be a middle ground, which is maybe a combination of distance learning and in-person learning. And then when we believe we're below the threshold on everything, that you can fully engage in in-person classes.
Son dos preguntas en una. Empezaremos por la primera parte. Hay preocupaciones del grupo de trabajo que se ha formado por parte de Salud Pública con las escuelas para saber si tienen suficiente equipo de protección personal tanto para maestros como estudiantes. Es la primera pregunta. La segunda es qué pasa si los 3 pasos métricos que se ha mencionado por Salud Pública el día de hoy no funcionan. ¿Se tendrán que cerrar las escuelas o qué sucederá? Empezamos por la primera pregunta. Bueno, el grupo que se reunió ya de maestros y de líderes escolares con Salud Pública han mostrado alguna preocupación en cuestión de asistirlos a ellos para mantener tanto el distanciamiento físico de 6 pies y poder asistir a los estudiantes si alguien se enfermara. No hay una preocupación que hayan mencionado en esta junta acerca del equipo de protección personal, pero acaba de mencionar que en las semanas pasadas también ya el Comando Unificado entregó los equipos de protección personal a las enfermeras de las escuelas o a las personas que la escuela designó para asistir en caso de una emergencia, tengan lo suficiente para asistir a ese estudiante o a ese maestro. La segunda parte de la pregunta es que si los 3 pasos métricos no funcionan, uno de ellos, ¿se cerrará la escuela entonces o qué sucederá? Bueno, no hay una guía todavía que diga cuáles son los 3 pasos específicos si uno falla o si los 3 están fallando. Tendremos que esperar qué es lo que dice el Departamento de Servicios de Salud del Estado, pero sí tenemos algunas etapas que estamos planeando. Por ejemplo, quizás las escuelas empezar a dar aprendizaje a larga distancia, como ha sucedido en algunos casos, o también en línea, o quizás dar en los dos, tanto en las aulas como también a la distancia.
All right, thank you, David, for the question. I think we got most of that covered there. So, Chad, who else do we have on? Has Danielle reconnected?
She has not. However, I am going to go ahead and read her question for her, if that's acceptable.
Sure.
It's directed at Dr. Sonnenschein, and she asks, while many districts have already pushed back their in-person target dates, several schools and districts are still aiming for an August 17 start. Based on the data you're seeing right now, is that a safe choice?
All right, thank you, Chad, for reading Danielle Lerner's question from ABC 15. Marcy will jump in on this one. All right, thank you.
Hi, Danielle. Thank you for the question. So at this point, with the data and the benchmarks that we discussed in the work group and that Dr. Sonnenschein presented, we would not recommend full in-class teacher-led learning at this point. A few of the benchmarks we're actually doing well and successful on. However, our percent of positivity is not at a place where we would say it is safe to bring all students and teachers back to in-person learning.
La pregunta es que mientras muchos distritos han decidido regresar al inicio o empezar el inicio del ciclo escolar como está planeado, otros han también dicho, bueno, lo vamos a posponer hasta saber qué está pasando con la pandemia. Y que si de acuerdo a los datos que Salud Pública tiene ahorita, ¿qué es lo que Salud Pública está recomendando? Bueno, al momento no recomendaríamos que regresaran todos los estudiantes y todo el personal docente a las clases. Tendría que ver cómo están las estadísticas y lo que están diciendo los números, pero ahorita no es el momento para regresar todo a las aulas.
All right, Chad, thanks for reading Danielle's question for her, so we make sure we get that answered. And thank you, Director Flanagan, for answering that. Chad, who else do we have?
Paul Marionak is next. Paul, your microphone is self-muted. If you'll unmute it, you're ready to go.
Can you identify the school districts represented in this work group, and are they the superintendents or other administration officials?
Thanks for the question, Paul. Director Flanagan will take that.
Thank you for your question, Paul. We had over 19 participants in our work group. Again, they represented all regions of Maricopa County. I don't have the attendance list in front of me, but of those I can remember we had, and they were at the superintendent level. We had superintendents from Chandler, from Phoenix Union, from Peoria. We had Basis Charter School and Cartwright, I believe, Mesa Unified, at Deer Valley. Outside of those, we could get you a list of all the school districts that were represented.
La pregunta es que si se pueden identificar los miembros del grupo de trabajo con el que está colaborando Salud Pública en las escuelas. Bueno, sabemos que esta primera junta que hubo 19 participantes de toda la región en el condado Maricopa. Aunque no tenemos una lista enfrente de nosotros, sí recordamos que algunos de esos distritos escolares incluyen los superintendentes de Chandler, Phoenix, Peoria, también de Basis, de Cartwright, de Mesa y Deer Valley.
I believe the county superintendent was represented there too, right?
Yes.
Yeah. So the county superintendent, Steve Watson, took part in this as well. So, Paul, if you need that complete list, just go ahead and email us here in the Joint Information Center. We'll get that for you. Chad, who do we have next on the line?
Michael Dowdman is next. Michael, your microphone is self-muted. If you unmute, you're ready to go.
Thank you. Sorry to change topics just a little bit, but 22 bodies were moved to coolers overnight. Are our medical examiner capacities now overflown? I mean, we talked last week about concerns that there'd be a clog in the system. Has that happened? And if so, what's the cause?
We do have excess mortality in the overall system, dealing with fatalities in Maricopa County. I can let Rob Rowley, Director Rowley, talk a little bit more about this, but I can confirm 22 decedents who the investigation is already complete. We're waiting for final disposition. They were moved out of the internal coolers and into the external extra coolers that the county has leased at this point. This was to create some capacity. No, the coolers are not overflowing, as you said, at the medical examiner's office. Director Rowley, would you like to add a little bit more about the plan and how we've implemented this plan? We hit a threshold that we felt like we needed to go ahead and implement the plan that was described a couple of weeks ago. I'll let Director Rowley expand on that a little bit.
So if you recall, a few weeks ago, when we made the decision to install the coolers and get them operational, that was all the result of planning that we have done with the medical examiner's office and a desire to make sure that we always had adequate capacity at our medical examiner's office. Going forward from there, once we had the coolers installed, additional planning with the OME what we are calling the temporary morgue site. And that was reached on Monday when the medical examiner advised us that they had reached 86%. So based on our plan, we decided to activate the temporary morgue site and move completed OME cases into the temporary morgue site. And these are decedents that are awaiting pickup from the funeral home system. As for what's actually going on in the overall funeral home system, we still don't have an exact answer for that. As was mentioned earlier, there has been an increase in deaths overall, actually a sharp increase in deaths overall in Maricopa County compared to this time last year. So with all of that in mind, we just wanted to make sure that we had always had plenty of extra space for the medical examiner's office so that they would be able to receive active cases and conduct their investigations.
La otra pregunta es que si 22 cuerpos mudaron anoche, precisamente fueron sacados de lo que viene siendo la oficina de médico forense, ¿a qué se debe? Y acaso ya alcanzamos la capacidad de almacenamiento en esa oficina. Bueno, mencionamos anteriormente que se han traído refrigeradores externos, y entonces ahora que se mudaron 22 cuerpos el lunes debido a que había un plan que estaba ya diseñado para cuando se alcanzara el 85% de la capacidad dentro de la oficina del médico forense de cuerpos, tendrían que activar este plan. Y este plan llegó a su capacidad el lunes con un 86%. Entonces lo que sucedió, se movieron 22 cuerpos a los refrigeradores que están externos para tener la capacidad dentro de lo que viene siendo la oficina del médico forense. Sabemos que ha habido bastantes muertes, entonces no sabemos qué está pasando con las casas funerarias, pero sí tenemos la capacidad de estos refrigeradores. Estos cuerpos están listos para que los recojan las casas funerarias y tenemos este plan para activarlo para una emergencia.
All right, thank you very much for that question. Chad, do we have somebody else?
We do. Peter Seymour is next. Peter, your microphone is self-muted. You'll unmute. You're ready to go.
Hello again. A couple of follow-up questions to what was been said in the last 10 minutes. When Director Flanagan says she doesn't recommend reopening classrooms, is that on August 17th and beyond, or is there a specific date she has in mind? And for Director Rowley, do we have any idea as to what's fueling the spike in deaths this summer in Maricopa County? Is it just the coronavirus, heat-related deaths? Do we know more about the causes of deaths?
A lot of the causes of deaths are under investigation. I know Dr. Sonnenschein has, we've talked a little bit about this and how long it's going to take for us to have a complete picture of what is causing the excess mortality in Maricopa County, not just this summer, but since about February. So we can talk a little bit more about that. Dr. Sonnenschein, and I'm blanking on your other question, Peter, I apologize. Marcy has the answer to your other question. So let's start with Dr. Sonnenschein, and then Marcy will bail me out. Oh, okay. We'll start with Director Flanagan then.
Hi, Peter. Thanks for that. So we're not really looking at any date specific. What's important to us is to look at metrics that we identify in benchmarks in our community and whether we're meeting those benchmarks. So I don't want to say that we won't be ready August 17th or we won't be ready until after Labor Day. What I'm saying is we're not ready to fully go back to in-person classes until we meet the benchmarks that we identify. We are waiting for those benchmarks to come out officially from the Arizona Department of Health Services this week. As you remember, in the governor's executive order, they were given a timeline of August the 7th to release those benchmarks. Given the benchmarks that we've discussed with our work group and benchmarks that we believe ADHS may consider, we are not currently meeting those benchmarks to have our schools fully reopen and go back to in-person teacher-led classes. And again, I wouldn't provide a date certain. We would provide looking at those metrics and those benchmarks, and as soon as we meet them, we would be fully supportive and engaged with our schools to bring students back.
Y vamos a hacer la segunda pregunta primero. La primera pregunta es que si recomiendan que el 17 de agosto se abran las escuelas o qué es lo que se está decidiendo. Bueno, al momento no tenemos una fecha específica, no nos estamos guiando por lo que viene siendo una fecha específica de abrir las escuelas, sino un sistema métrico o parámetros para poder regresar a clases. No estamos hablando que el 17 de agosto o que después del Día del Trabajo, no se sabe una fecha específica. Todavía estamos esperando los lineamientos del Departamento de Salud del Estado que dejaron que van a darlos el próximo 7 de agosto, pero al momento no estamos en condición de regresar a las aulas, tanto los maestros como todos los estudiantes.
Hi, Peter. So to address your question about why we're seeing increasing deaths, as Fields mentioned, there's always a delay between when somebody dies and when we can determine the cause of death. And so our data are often delayed for that reason. What we can tell you is that we did see a significant increase in the number of deaths in June and July. And we know that many of those are due directly to COVID-19. But we've also seen an increase since the beginning of the year, and importantly, of deaths that we believe are indirectly related to COVID-19. So we know that there are other effects of the pandemic response, including people who may be hesitant to seek care in a healthcare facility, may delay care for their conditions, so they may succumb due to their heart disease or diabetes or other condition because they didn't go to the hospital in time. Or it's also possible that they couldn't get the routine care that they needed, and that can indirectly increase deaths secondarily related to COVID-19. So that's something that we're going to be able to sort out when this is all over, but right now we can just tell you that the number of deaths is increased, and we anticipate that that increase will sustain itself for at least the coming weeks.
La pregunta es, ¿por qué tantas muertes se han registrado este verano y si son por COVID o por cuál es la razón de estas muertes? Bueno, lo que sabemos es que algunas de estas muertes están bajo investigación al momento y sí, hay un retraso. Cabe mencionar que desde que una persona fallece y cuando se da la razón de muerte, existe un retraso en el tiempo. Entonces, sabemos que ha habido más muertes en el mes de junio y julio, y estas son por COVID-19, pero también hemos visto un incremento de muertes desde el principio del año y pueden ser relacionadas a COVID-19. Estamos hablando de personas que quizás tengan condiciones médicas crónicas como problemas del corazón y que no reciben el cuidado médico adecuado al momento o han decidido esperarse para recibir atención también por lo que está pasando con COVID-19. Y cuando estas personas fallecen es una causa secundaria a lo que viene siendo COVID-19. Así que sí anticipamos que seguirá creciendo en las próximas semanas todavía el número de muertes.
Peter, thank you so much for the questions. Chad, do we have anybody else with a question today?
Looks like that was the last question filled.
All right, very good. Thank you all for your good questions. We appreciate it. We appreciate everybody's time. Thank you to members of the public joining us on Facebook and YouTube as well. We will let you know about our next availability sometime next week, very likely. So thank you again for being here today, and we'll see you next time.